This video is strictly for educational purposes only. I do not condone or glorify the usage of drugs. My name is Low-Key Fish, and in this video I'm explaining everything you need to know about the medication called bupropion, also known as Wellbutrin or Zyban. This is a medication used to treat things like depression, ADHD, or quit addictions like smoking. I'll explain the benefits, side effects, the dangers, my own experiences, and much more. What is bupropion? Sold under the brand names Wellbutrin and Zyban, bupropion is an antidepressant clinically used to treat depression or help quit smoking. It's also commonly used to treat ADHD, obesity, seasonal depression, or quit addictive habits such as nicotine. Bupropion was actually the first pharmacological treatment for nicotine addiction other than nicotine replacement therapy. It takes up to 4 weeks of daily use for the maximum effects to appear because that's when it enters the bloodstream. This is the main reason that its treatment is meant to be long-term. The positive effects include stimulation, mood lift, depression reduction, and increased focus. The negative effects include paranoia, increased heart rate, dry mouth, nausea, insomnia, and agitation. Also, something to note is you typically don't want to take it at night because it will keep you up and give you insomnia due to the fact that it's a bit stimulating. The most common reason bupropion is prescribed to people is for long-term treatment of depression. If used over an extended period of time, you'll find yourself having more energy, greater pleasure in activities, and increased motivation. Long-term daily usage is where the drug shines the most because that's when it will be most present in your blood. In smokers, specifically cigarette smokers, it raises the possibility for them to successfully quit by reducing withdrawal symptoms and cravings. It's not very recreational for short-term use because you need a large dose just to get a very minor noticeable stimulation or mood lift from it. Bupropion is taken orally and comes in 3 forms: instant release, extended release, and sustained release. Dosing usually begins around 100 to 200 milligrams and is increased over a period of weeks or months up to a maximum of 400 to 450 milligrams. At high doses such as over 600 to 1000 milligrams, you run a risk of getting a seizure from it. Personally, I was prescribed it a few years ago, and my doctor gave it to me with the main objective of giving me a more positive outlook on life. What originally happened was I had back surgery on my lumbar spine, specifically a spinal fusion, and after overcoming that horrible mess, it ended up getting infected. So I had to get another back surgery just to deal with that. And even after my second surgery was done, I still had to have a PICC line of my own for 12 weeks. A PICC line is a long catheter tube that is inserted through your arm and goes all the way directly to your heart. And 3 times a day, I had to inject powerful antibiotics to go straight to my heart. It was at this point that my primary care doctor recommended for me to go on Wellbutrin, specifically 300 milligrams of the extended release form. The idea of putting me on this medication was to give me a more hopeful perspective on life. This is because I was going through a lot of pain, dealing with multiple failed surgeries, I was constantly in and out of the hospital, and just enduring a lot of difficult life obstacles. Mind you, all of this while still being a full-time college student. But anyway, after being on that for just a few days, it was definitely changing my mindset to be more positive and gave me that go-getter attitude. It made me more energetic and ambitious to tackle the obstacles I had ahead of me. Additionally, it gave me more focus and drive to accomplish what I needed to get done. Instead of trying to victimize myself and adapt this why me mindset, I became more content with the fact that the universe doesn't care about your feelings. Sometimes you just gotta do what you gotta do. I ended up being on it for about 2 years or so, and I never really found any huge negative side effects from taking it. Aside from the occasional insomnia, all bupropion did was elevate my mindset more, and the insomnia only occurred if I took it at night instead of in the morning. Anyhow, bupropion has definitely helped uplift my attitude about life. I know that without it, recovering from my back problems would have been much more of a challenging feat. All in all, Wellbutrin and Zyban have more positives than negatives, and if you suffer from things like seasonal depression or just have a toxic mindset, bupropion can most likely help you out a little bit. Never look to drugs as a cure, but more as a tool to help you be your better self. Bupropion is definitely a nice tool to have at your disposal. I'm Low-Key Fish, peace out.